In many communities across Katsina State, access to life-saving vaccines remains a challenge. For some families, distance, limited awareness, and health system gaps mean that children miss essential immunization, leaving them vulnerable to preventable diseases. Routine immunization is one of the most effective ways to protect children. Yet, many children, especially those in underserved and hard-to-reach settlements, remain unvaccinated or under-immunized. These are the zero-dose children, the ones most at risk. To address this gap, the Consequential Geography project introduced the Optimised Outreach Sessions, a targeted approach designed to take vaccines directly to the communities that need them the most. In March 2026, health teams were deployed across selected locations in Katsina State, bringing immunization services closer to underserved populations. Prior to implementation, extensive preparations were carried out. Community-based volunteers were trained to ensure a focused and efficient response. Community leaders were also engaged, strengthening trust and mobilizing caregivers for the outreach. At the center of this effort is EMIDAS, a digital platform designed to track and monitor immunization activities in real time. With EMIDAS, health workers are able to identify missed children, record vaccinations, and improve accountability across the system.
The EMIDAS app ensures that no child is actually left unvaccinated. It's able to vaccinate a cohort of children in a particular round of OOS, and you are sure that you are reaching the same children.
Across communities, vaccination teams worked tirelessly, engaging caregivers, administering vaccines, and ensuring proper documentation. For many families, this outreach provided a rare opportunity to access immunization services within their communities, bringing not just vaccines, but hope, protection, and a healthier future. The strong turnout of caregivers across communities reflects growing trust in immunization services and increased awareness of the importance of vaccines. In many locations, teams worked efficiently to manage large numbers of caregivers, ensuring that services remained organized, responsive, and accessible.
So OOS is one of the strategies that we are supporting in this Consequential Geography project. And as you can see by the back here, we're having one of the OOS teams. And actually what we are trying to do is to ensure that all the teams enumerate, they vaccinate, and then they document on vaccine utilization. We have vaccinators, we have recorders, we have house-to-house mobilizers, and then we have town announcers who have been going around making announcements for everyone that will try to come out with their card so that we can verify their vaccination skills and then provide vaccine to all the children that are eligible. For those that are not eligible, of course, we are able to update them on our EMIDAS platform, and then we book them for the next round of vaccines when they are due. We've gone down to the field and we have actually seen that these things are doing well. The population, the turnout is very good. This community is actually one of the communities that were missed in the last round of OOS implementation, and the teams are here to ensure that all the other 2 children are line listed and enumerated. And we've actually recorded very good turnout in both resolving non-compliant cases, vaccinating zero-dose children and under-immunized, and even children who are due but they have been called dead for one reason or the other. We really appreciate CDC for funding this project, and the state also for supporting us to ensure that we have a successful implementation of OOS.
By the end of the 5-day OOS implementation, thousands of children had been reached across targeted consequential geography settlements. Each child vaccinated represents a step forward towards stronger immunity, healthier community, and a safer future.
Kafin zuwan wannan program na CG, muna fuskantar matsaloli kamar rashin halartar su client zuwa asibitoci, amma shigowar wannan CG program ya taimaka mana wajen binciken kwakwaf akan cututtuka masu haɗari da kisa ga ƙananan yara, sannan kuma ya ƙara taimaka wajen community engagement. Muna jawo hankalin al'umma kuma gaskiya alhamdulillah suna shigowa, suna karɓar allurorin rigakafi, muna binciken kwakwaf kan cututtuka masu haɗari kuma gaskiya ana samun ci gaba alhamdulillah.
The Optimized Outreach Session strategy is more than an intervention. It is a commitment to equity to access, and to ensuring that every child, no matter where they live, receives the protection they deserve. Because every child counts.